Where is the urgency for children in Sudan, for those in Yemen, for the countless other conflicts tearing young lives apart? Why is it always Gaza? Could it be, perhaps, because it fits a convenient political narrative, one that the Labour left are losing to the pro-Gaza bloc in their own party and on the far left? Well, frankly, I think it is. I want compassion, yes, but compassion must always start at home. Right now, British children are suffering, waiting and in many cases deteriorating, while politicians chase headlines and foreigners once again before British people. Our kids deserve better. Our NHS should be the ones putting them first. And if the government can fast-track healthcare for foreign nationals, then it can damn well do the same for our children, can't it?
Hello, I'm Bev Turner. Now, it can feel like...
Children, 240,000 of them, are waiting for hospital treatment on the NHS. The British government is rolling out the red carpet to bring children from Gaza into our country for treatment. Now, let me be clear. Nobody, and I mean nobody, wants to see children suffering. No matter where they're from, children are always innocent. And it breaks my heart to see any child suffer. But compassion can't come at the expense of our own, ever. It cannot be acceptable to tell British children who are suffering to wait a year, sometimes two, while foreign children are prioritised and fast-tracked into our already broken system over a war that simply doesn't concern us. While the Labour government prioritises those abroad, Britain's children are being failed on what I think is a historic scale. The numbers are staggering. Over 340,000 kids waiting for elective care, 240,000 children waiting for community care, 8,000 waiting more than a year just to get into a hospital, and another 4,000 waiting for more than a year for community care.
Introducing the Ultimate Glasses, a seamless extension of your vision that combines reading, computer, and sunglasses into one smart solution. Meet the revolutionary autofocus glasses equipped with breakthrough German optical technology. No more expensive eye exams or long waits for new glasses. The patented LCD lenses adjust in milliseconds, providing crystal clear vision whether you're looking at your phone or reading distant signs. But that's just the beginning. These lenses...
Things are getting worse, not better. In March this year, more than 314,000 children were waiting for community health services. That's up from 272,000 the year before it. A staggering 22% of them have been waiting over a year. That's nearly 68,000 children left in limbo for over 12 months. 15,000 of them, 5% of all cases, left on a waiting list so long that there'll be no longer children by the time the NHS has stopped dithering and helped them. Why is it always Britain that has to take on this burden? Where are Jordan, Qatar, Egypt, the UAE, nations with immense wealth, brand new hospitals, some of them, state-of-the-art medical facilities and capacity? Why aren't they stepping up? Instead, we're told it's our duty, that somehow Britain must always be the one to swoop in, even as our own kids sit on waiting lists in pain and forgotten. And let's be honest, this isn't just about medical care. Those children don't come alone. They come with families. 50 companions arrived alongside these 10 Gazan children. And what do you think? Once they're here, will those families ever go back? I would bet my last penny that not a single one of them will ever be leaving this country. And it seems to me this is yet another backdoor to create a legal loophole to allow more migrants into our country. And just as we saw yesterday, with reports claiming that Afghans who have been relocated to Britain to protect them from the Taliban have in fact returned to the country on holidays. Can you get that? The source also claimed that some Afghans coming to the UK had already been granted asylum in other safe countries such as Denmark or Belgium, while others who were relocated only spent 1 or 2 days as interpreters with British forces. Meanwhile, where is the urgency for children in Sudan, for those in Yemen, for the countless other conflicts tearing young lives apart? Why is it always Gaza? Could it be, perhaps, because it fits a convenient political narrative, one that the Labour left are losing to the pro-Gaza bloc in their own party and on the far left? Well, frankly, I think it is. I want compassion, yes, but compassion must always start at home. With you, Linda, these are complex things. I still think there's other states across the Middle East that could deal with this.
I
We
agree.
could give them money to do it, and I don't
Mm.
actually mind us doing that either. Or sort of do, sort of don't. Paul, is this a backdoor loophole to allow migrants to come in from Gaza?
No, but why do you think those other states aren't doing it? I mean,
that's a good question.
I think they probably are. I don't think we have any evidence at all that they're not also taking desperately children in desperate need.
Gaza and refugees whatsoever.
However,
as far as we know,
I mean, the NHS last year had 135 million outpatient appointments, right? And we're talking about 10 here. So in terms of scale, it puts no pressure on the NHS whatsoever. I'm glad we're talking about the National Health Service because obviously there is a national conversation that needs to happen around how we get those waiting lists down, and this government is attempting to do that. It's using money, by the way, raised from national insurance, which I know everyone then kicked off about the rise to NI, but that's where the money went to get these waiting lists down, including for children. But 10 kids, and including their carers, is not